This is the Foothills Medical Center in northwest Calgary, Alberta. It's one of the biggest and most sophisticated hospital complexes in Canada. Every year, nearly 750,000 patients come through the doors of the Foothills. Almost 2,000 patients a day. Most of them are seriously ill. And every day, about 10,000 people come through these doors to work.
Hi, good morning.
One of those working people is Shirley.
Just grab my pager here and my paper.
Shirley is a housekeeping aide.
Hi, Audrey, Krishna, good morning.
Over 800 housekeeping aides work at the Foothills.
I'm good to go.
Over 130 of them are on shift right now. But these aides are more than just cleaners. They're soldiers in a life and death battle, a war against infection. Like every hospital in the world, the Foothills is plagued by the deadly bacteria we call superbugs. Anywhere you treat serious illness, you find serious infection.
So it's down here. There.
In Canada, hospital-acquired infections kill over 8,000 people a year. It's Shirley's job to travel these miles of corridors and kill the superbugs.
I'm getting my cart ready. I need to fill up my bucket.
There are more than 1,000 beds in the Foothills. Today, Shirley will clean and disinfect 7 or 8 rooms, including isolation rooms. Isolation rooms are known danger areas where high levels of bacteria have been detected.
Just pick up a bag of rugs and ready to rock and roll.
Superbug expert, Dr. Stephanie Smith.
My name is Stephanie Smith, and I'm one of the physicians in the Division of Infectious Diseases here at the University Hospital, and I'm also one of the medical leads for infection prevention and control.
Dr. Smith uses the medical term nosocomial infection.
Nosocomial infections are any infection that a patient picks up while they're in hospital.
The worst nosocomial infections are called antibiotic-resistant organisms, or superbugs.
When we're talking about environmental contamination and housekeeping and how that plays a role, then C. diff, MRSA, and VRE are probably the most important ones.
The superstars of superbugs, Clostridium difficile, or C. diff, methicillin-resistant Staphylococcus aureus, or MRSA, and vancomycin-resistant Enterococcus, or VRE. C. diff, MRSA, VRE. They're all potentially deadly, and in rooms throughout every hospital, they're living and breeding invisibly.
Now we're going to 7th floor.
Right now, Shirley is on her way to the room of an infected patient, an isolation room.
This is an isolation room, so I'll just want to start cleaning in this room.
The patient in this room has MRSA.
These are high-touch area.
Anywhere the patient has touched, he could have left deadly MRSA bacteria. Shirley has to be thorough and careful.
For the antibiotic-resistant organism, VRE, MRSA, and then for C. diff as well, we ask healthcare workers to wear gowns and gloves, and that's basically to protect both patients and healthcare workers.
MRSA is one of the world's toughest superbugs. For years, doctors tried to kill it with a variety of antibiotics, but it just kept getting stronger.
In hospitalized patients where they're more susceptible to infection, then it can cause a huge variety of infections. So it can cause pneumonia, it can cause bone and joint infections, it can cause a bacteremia, it can cause heart valve infections, and then it can cause soft tissue infections.
In the meantime, the bugs make their homes in the patient's room. They can live anywhere, and Shirley hunts them down, top to bottom.
Top to bottom, top to bottom, and the ledges too.
As soon as Shirley finishes, the patient will return, and so will his MRSA bacteria. For a while, the room will be much safer for anyone who enters, but the superbug won't give up. 11 years ago, the MRSA bug attacked a patient who was in for a routine ear operation. Ironically, the patient was a respected veteran nurse. Her name?
My name is Hazel. In 2003, it was discovered that I had MRSA in one of my ears.
The infection turned Hazel's life into a nightmare.
I had such throbbing pain that just sets me back to think of those years, because those years are gone, but it brings it back to me, brings it back.
The superbug took over Hazel's life, but it didn't stop there. Hazel lives with her elderly mother. She took every precaution, but eventually the inevitable happened.
My mother was tested, and she also was positive for MRSA.
Hazel's mother showed no sign of infection, but she was colonized. Dr. Smith explains.
If a patient is colonized, that means the bacteria is residing on their skin, in their nose, sometimes in their lungs, and not causing them any problems. But basically, when patients are immunocompromised in any way, or they have any kind of breach in the normal barriers, so skin or mucosal lining, that kind of thing, then bacteria can basically get in and cause deeper infection.
Hazel worked day in, day out for 2 years and finally got the bug out of her home and her family.
It did change my life. It did.
But the uncertainty remains.
Yes, I'm afraid that it could return. I'm afraid of that, yeah.
The superbug problem can be traced back to the 1940s, when the world discovered the wonder drugs, antibiotics, and got carried away.
Since the beginning of the antibiotic era, then we've seen resistance developing as we've developed antibiotics. So the bacteria, I think, are pretty smart, and they're always probably going to win out in terms of being able to develop resistance. So I think it's very difficult for a hospital to completely eradicate these antibiotic-resistant organisms.
After cleaning an isolation room, Shirley will change all her mops and rags, her gloves, her gown, replace everything.
This one's already contaminated, and my gloves too. Yeah.
To battle superbugs, Shirley works closely with the hospital's Infection Prevention and Control Team, or IPC.
We do a lot of surveillance, and we kind of monitor for infections and advise on how to manage antibiotic-resistant organisms such as VRE, MRSA on the individual units.
How about in some other private rooms? Can I get in?
The housekeeping staff usually have a good relationship with the nurses and with infection prevention and control, and the housekeepers are really invested in their job there because they know the patients and they kind of see it as their job to protect these patients and everything. Then it works quite well.
Yeah, you be careful, sir.
Yeah.
The floor is kind of wet.
Despite the hard work of Dr. Smith, Shirley, and their teams, the superbugs are holding their own. Alberta Health Services has not published any reports on the battle in this province's hospitals, but there are national studies.
Across Canada, we have done 2 studies, one in 2002 and one in 2009, looking at the prevalence of nosocomial infections in Canadian hospitals. And we found a fairly similar prevalence at about 10%, meaning 1 in 10 patients in hospital has a nosocomial infection.
10%. And despite massive effort, that number hasn't improved since 2002.
There's probably a number of reasons why rates aren't going down. There's host factors, so patients tend to be more acutely ill. We tend to have a higher proportion of immunocompromised patients that are more at risk of infections. We have a high turnover of patients, so patients are being discharged sooner and their kind of illness acuity is quite a bit higher, making them more susceptible. And then issues like staffing, movement of patients around the hospital, that kind of thing can also contribute to higher rates of infection. So even though we're doing a lot of things from the infection control point of view to try to bring rates down, I think there's also some forces that are working against us.
The most common superbug is still MRSA, but IPC teams are finding more cases of VRE. A VRE infection can take many forms.
The common infections that we see are usually bone and joint infections, intra-abdominal abscesses, that kind of thing, are probably wound infections are the most common.
Make sure also have to clean the under this mattress.
The bugs don't just attack a few patients. They attack the whole hospital, affecting everyone.
It puts a huge amount of pressure on the whole healthcare system because if patients need to be in hospital longer because they require IV antibiotics or they're slower to improve from their infection, then that basically just creates this huge backlog all the way down to, the emergency department where people are admitted down there and can't actually get up to the wards because there's no beds on the wards because they're being taken by these patients. So yeah, there's certainly a domino effect and it can create significant problems.
Nothing shakes up a hospital like an outbreak of Clostridium difficile, C. diff. Every so often, C. diff makes national news when outbreaks cause multiple deaths. But smaller outbreaks occur all the time, and the superbug is a regular visitor to Alberta hospital rooms. A few weeks ago, C. diff entered the lives of a young, healthy Edmonton couple, Darren and Heather. While she was horseback riding, Heather's lung suddenly collapsed. She was rushed to hospital.
What was supposed to be a very simple 45-minute surgery turned into a 4-hour affair in the surgical suite. It was quite a difficult time, and we thought we lost her a couple times.
The surgery was serious but successful. Heather should have recovered quickly, but days went by.
Each day that went by, she was feeling more and more uncomfortable, and she was in the washroom constantly. And she couldn't eat. She hadn't eaten in a week because every time she ate, she would throw it up or have to go to the washroom immediately.
After 4 days of this, Heather and Darren got an explanation.
The doctor walked in a yellow gown and gloves, and we couldn't figure out why she wasn't coming all the way in the room. And all of a sudden she came in and she said, "Heather, I've got some good news and I've got some bad news. The good news is it looks like your lung is starting to heal. The bad news is you've picked up a superbug." And Heather was very scared.
She was right to be scared. Sometimes the only cure is a colon removal, or colectomy.
About 2% of patients that are hospitalized with C. difficile infection end up having severe outcomes such as colectomy or death.
Probably the worst part about it is when you're in the hospital, they don't even let you use the washroom once they know you have it. They make you use a portable can that sits in the middle of a room, which is very humbling.
After 4 days, Heather was discharged, but the nightmare had just begun.
You throw up every 20 minutes. You go to the bathroom every 30 minutes, or more often. You can't sleep through the night. You have to take these pills 3 times a day, pretty much exactly when they say. It's horrendous, and each day you lose more and more weight.
But Heather is young and healthy. She survived.
So after 16 days, she's now thinks that she's gotten rid of the superbug, but they still don't really know, and it could come back. And she doesn't want to do this all over again.
There are few resources health authorities can use to fight superbugs. The bugs have outsmarted all the expensive antibiotics. Campaigns to promote hand washing have helped, to a point. But nothing kills more superbugs faster than a mop and a rag in the right hands.
Housekeeping is absolutely pivotal. With antibiotic-resistant organisms such as VRE and MRSA, we know that the environment gets colonized quite quickly, and housekeeping is there to wipe away all that room colonization, and so that when that patient is discharged and a new patient goes into that room, that they don't then acquire an antibiotic-resistant organism from touching the surfaces or anything like that.
Ready to rock and roll.
They are a pretty integral part of the team, and they should always be viewed that way, and I don't think that they get the credit that they deserve as much as they should.